Well, good evening, everyone, and welcome to our Tuesday evening introduction to LifeWave, our special technology. And we have a special guest on tonight, too. I'm your host, Robin Blake Mascari. And what we're going to do in the next half hour is a short introduction to a very special company. We're going to learn a little bit about the technology and the star of the show, X39, which is our stem cell activation product, although it does a lot more than just that, but that's kind of what we call it. And then I'm going to introduce our special guest this evening, Dr. Stuart Freedenfeld, and we're going to turn things over to you. And if you have stories to share or questions to ask, please use the Q&A. That'll make it much easier for me to be able to see them. And just remember, we are here as a natural products company. We don't attempt to or treat, diagnose, heal with any of our natural products. It's the body that does the work. And so when it's your turn to talk, please make sure you share symptoms only. And please stay away from naming any disease state. Okay, so let's jump in now. And LifeWave, a very, very special company. This company started actually in 2004. And it's now 17 years old. It'll be 18 in November. Very special company. And it started when our genius founder was on a government contract creating something for the Navy SEALs. It was some survival products, and it was to help them actually stay awake in their mini subs without any kind of chemicals or stimulants. And he created this wonderful product, and it was very effective. And then 9/11 happened, and the government had different priorities. And so he was actually guided to use the form of network marketing, which is a form of distribution, because it's a product that requires a story behind it. It requires our voice to share about it. And the company was born in 2004 with a patch called the Energy Enhancer Patch. That was the one created for the Navy SEALs. Well, one day, David got a call from Richard Quick, who was the Olympic swim coach for the women's team. And he said 6 of my 8 swimmers did their personal best. Well, a lot of attention was given because the swimmers were noticed that they had these patches on them. And so they're all these drug testing. Anyway, bottom line, that the Olympic Committee realized there's nothing that went in the body. The patches are non-transdermal, so there's nothing that goes in the body other than a frequency of light. And it's taken off all over the world in just about every sport you can imagine for athletes, because it enhances strength, stamina, and performance, and reduces recovery. So you might see some of your favorite athletes. It's hard in the winter sports, but in the Summer Olympics, you can notice them on the athletes. And you might notice on some of the NBA players, tennis players. So a lot of famous people use these patches. And David's an inventor, and he has over 130 patents and patent pendings to his name. Sorry about this. I have a funny little thing. Sorry about that. And he just kept inventing and creating more and more amazing products using a kind of technology called photobiomodulation. It's using your body heat, the infrared heat in your body, to activate the crystals in the patches and cause a biochemical change. Well, there were 3 phases of the company, and the symptom phase, which was the beginning one, and then he went into the anti-aging phase with our YH patches. And then the last 10, 12 years, he's in the regenerative science phase, where this new technology that activates a very important copper peptide called GHK-Cu gets activated. And we do invite you to do your own research on that, because that's the magic behind our lead product called X39. The company changed when that came out in January of 2019. And since then, that first year that it was out, the company tripled in size and in sales and size. We are in over 75 countries. Actually, in a few weeks, we're opening Thailand. Gregory is in Thailand right now to be part of that launch on March 20th. And for those of you that are interested, we have all kinds of resources for you to tap into that market. And there's 15 distribution centers all over the world. So it's a very exciting time to be with LifeWave. They're constantly growing and expanding. And David, is constantly in the lab. He's a genius. He's our founder, but he's an inventor and a scientist, and that's what he loves to do. And he's constantly working on how do we crack the code to actually accomplish age reversal. So this evening, we're going to get to hear a little bit more about that in the activation of these stem cells. And I just want to make sure I've covered everything I wanted to cover. David is truly a servant leader, and anyone who gets to know him is quite touched by who he is and where he comes from, because he's really committed to enhance the human condition with his inventions. So now what I'd like to do is invite on our special guest this evening, and his name is Dr. Stuart Freedenfeld. He comes to us as an MD. He got his medical degree with honors at the College of Medicine and Dentistry of New Jersey, and then he went on and did his residency in family practice, board certified at the Academy of Family Practice, president of the Hunterdon County Medical Society, was a clinical instructor at Rutgers, and then something changed. In 1988, he expanded beyond the conventional allopathic medical world and became a student of nutritional therapies, homeopathy, herbalism, traditional and Chinese herbalism, and gave his patients the option of integrating these therapies along with the conventional therapies that he was involved in. So he is a respected lecturer in the areas of autism, ADD, ADHD, and detoxification, and is considered a leading expert in the integration of multiple forms of healing. So I get to bring on Dr. Stewart. Welcome.
Oh, there we are. Hello.
Hi. So nice to have you.
Tonight.
Huh?
You're alone tonight. Greg has abandoned you.
Do you need to remind me? No fancy technology tonight. It's just you and me, okay?
You got it.
All right. Well, it's wonderful to have you, Dr. Stewart, and you're such a gift to our community. We have thousands of healthcare practitioners that love LifeWave. So why don't you share with people a little bit, Dr. Stewart, of what it is that had you be interested to even check out this company and these products?
Mm-hmm. I got involved with the Patches first through a dear friend, a fellow physician who I've known on the lecture circuit, and she had found some wonderful patches and said, "Gee, Stuart, you've really got to try these, and let me know what you think." And of course, my skepticism said, "Yeah, sure." But I always maintain an open-minded skepticism, and I was very, very pleasantly surprised. I had very immediate personal results in a number of areas. The love of my life also had very quick results. So we were both very impressed.
Wonderful, wonderful. And there's nothing like building your belief by having your own experience. And we love healthy skeptics. They're my favorite, actually, because when they get converted, it's all over, And so you had some great results. And then, we keep talking about this thing called stem cells. And I know the media has done a lot of work, and it is the future of medicine. Could you share with people why stem cells are so important, a little bit more about what they are and what happens when we age to our stem cells?
Well, there's lots of futures of medicine, and stem cells is one of the exciting areas. So our stem cells are primordial cells, the cells from which everything else originates. We are a stem cell that evolved. We were a sperm and egg that got together and formed an ovum. And that ovum was the primordial stem cell of everything else that followed. All of the DNA, all of our genes were encompassed in that one cell. So if we think about the volume of DNA as the encyclopedia of all the knowledge that our cell has to offer, that encyclopedia is opened or closed at certain pages. So the cell changes, and it changes by shutting down certain genes, opening up certain genes to be read. And that is a process that continues to evolve, so that one cell divides and divides and divides, and we get 2 cells, 4 cells, 8 cells, 16 cells, and eventually some of those cells begin to differentiate. Some of them go on to form placenta and all the placenta parts. Other ones go on to form the baby, the embryo, the amniotic sac, and all the other parts, and then into the muscles and the bones and the heart. And all of this is from a stem cell that begins to specialize in different patterns. Those stem cells is what heals the body, what creates the organ. So when you damage, you break a bone, your bone cells don't divide. You get stem cells that produce new mesenchymal cells and the bone elements. And such, all of our growth and healing is occurring from the stem cell outward. So those stem cells are what we need to keep us going.
Wonderful. So we all started as a stem cell, and
We also
right. And then we became a stem cell, and then we became a whole bunch, and then they differentiated. They're very, very special cells. So what happens as we age, Dr. Stewart, with our stem cells? Because you said they are part of our repair system. Yeah.
Sure. Unfortunately, the number of stem cells and the vitality of those stem cells begins to decrease in both areas. So we have less ability to heal. Our creaky bones and aging muscles and joints are less able to keep up that joie de vivre. So when the numbers decrease, it is more difficult to repair.
Mm-hmm. So they're not we have less of them. And so as Gregory likes to say,
and they're less vigorous. They are less
exactly less vigorous. So this very special product actually activates our own younger stem cells and creates even more from our skin. Because as we get older, we don't have so many. And that's why Gregory likes to say, the older we get, the faster we age, the slower we heal. And it's because of stem cells, isn't it?
Amongst other things.
Yes, amongst other things. Yes, exactly. Okay, so this product that activates this copper peptide and activates our stem cells, who's it for?
Well, let me back up, because I want to be a little bit clear about that. What our stem cells, a lot of people have been getting stem cell injections, stem cell infusions, and what they'll do is take some fat and concentrate stem cells, select stem cells out of that, inject that back in, or they'll get bone marrow and get stem cells out of the bone marrow. But those are already mature stem cells. They have already differentiated, and they can only form certain lines. You can't repair brain cells from mesenchymal cells. You can't repair liver from a bone cell. So what we're able to get with the X39 is a undifferentiated stem cell.
Beautiful. That's a really, really important clarification for people. Thank you.
It's what we call pluripotential. It's able to form everything.
Well, how exciting. So we have this product called X39, and who is it for?
People who want to be young and healthy and vigorous and enjoy life.
Like you?
Like me.
Do you want to share with everyone some of your athletic activities and your age, just so they get a sense of a little bit more of how amazing you are?
Please. Let's see. I'm going on 74 this year. I have maintained a athletic vigor throughout my life. I bike, I hike, I kayak. I still play soccer with a competitive league, and ages down to 20s. So it's a pretty rough league, and I enjoy playing and enjoy the vigor. I never enjoyed the post-game achiness that occurred. And one of the first things that I really enjoyed with X39 was a remarkable decrease in the post-game pain, the recovery time. Instead of taking 3 or 4 days to get back to feeling okay, I was feeling okay that day.
That's huge.
Well, for me, it is huge. To
Oh,
not have to struggle to get up out of a car, and not have to struggle to get out of a chair because your lower back hurts or your neck is hurting. It just makes my life so much more pleasant. Yeah.
what a relief, isn't it? That something so simple can have such an impact on the quality of your life. And so you and your loved one got really quick results, but how long does it take for people to really notice something? Because why don't you share?
Some people it is very quick, and that's wonderful, and we all like to applaud those wonderful things. But in my experience, it's not the most common. I think most people will find a much slower response that may be a month or 2 or even 3 months, and it's a gradual improvement. I think often pain goes away quicker than most other things, and there are typical places that we put the patches for general health, say the back of the neck or below the belly button are common areas. But if there is a localized pain, putting the patch right on that pain site usually is just very quick. I'm ridiculously quick, sometimes minutes. And yeah, I must have been wrong. I didn't really have pain.
And that was just the after effect of the rigorous workout. So some people can feel it rapidly, but typically it may take some time for people to experience that. And we do have some other patches. I kind of like to call X39 being the long game, doing the repairing and regenerating and activating those stem cells. And then we do have some pain patches and the anti-inflammatory where people can actually feel the results really quickly. Yeah. Mm-hmm. Is there anyone that should not be using this product?
There are general cautions. People who are getting cancer treatments, chemotherapy, people on immune suppressive therapies. But I've said before, as a physician, I might have a different approach than the general lay public. And there are situations where I feel very comfortable in using something that has an immune boosting benefit, even though we're trying to immune suppress somebody for therapeutic reasons.
Okay, so it's with nothing going in the body, it's really important for people to know that they're safe and they're not going to counter indicate anything you're taking or doing because there's nothing actually going in the body. But if people are on immune suppressing medications, some of our products actually enhance the immune system, so they could be counterproductive. But there's not a safety problem.
The nice thing about naturopathic treatments where we are supporting the body mechanisms, is the body knows best. And if we give the body the nutrient and say, here, take this, see what you need and use it for what is important, the body will do just that. And there's almost no naturopathic nutrient that will cause a problem.
Which is great to hear. And so just a little bit, Dr. Stewart, can you share about how we use this product and what are the ideal conditions for people to get the maximum benefit?
Well, anything in health, you can get the maximum benefit if you look at yourself holistically. You want to eat good, healthy food. You don't want to eat food that's been poisoned, and so eating more organic food rather than stuff that's been treated with pesticides and herbicides and whatnot. You want to have adequate fluids. You want to have a good, healthy physical range of motion, activities. You want to have a healthy mind and not carry anger and resentment in your life. So all the things that make you generally healthy allows your body to spend the energy in maintaining health rather than fighting off other disasters that we dump on it.
Yeah. So, and what you just said is what our founder says all the time is we have to do our part. We have to make healthy choices in our lifestyle with food, hydration, rest, nutrition, a variety of things. And I love the way you added in what goes in our mind, that is an important part of our health. And if we're holding on to something, it could cause some additional stress that could lead to other things, and decrease the quality of our health. So any other final comments you want to share before we open things up for people's stories and questions?
Oh, I don't know. And there's so much. I've had so many experiences now. I had the chance to play around with lots of the different patches and get my own experiences and play with them with a lot of my patients and clients and friends. So
yeah. And
well,
have you tried the new product yet?
Oh, absolutely. Yeah.
And tell us, because why don't you tell people what it is and what you've noticed before we open things up?
So X39 stimulates GHK, a tripeptide that's a signaling molecule. It turns on various processes. The X49 stimulates AHK, another tripeptide that has another set of benefits that are signaled by that. The combination has been found in a lot of athletic folks to increase their strength and stamina. Pretty high, remarkable percentages, 20, 30, 50% improvements. When I first put on the combination, I added the X49. A week later, my gym workout, I go to the gym 3 days a week for a couple of hours of workout. My workout on a specific apparatus where I might be doing 20 reps, 3 sets of 20 reps. I was doing, after a week, I was doing 25. And after a month, 6 weeks, I was doing 40.
Whoa.
So it actually doubled. Yeah. I don't increase the weight that I work with. I'm more interested in stamina for what I do. So that increase in stamina on an elliptical, gerbil type gym activity. I do a pretty heavy sprint jog workout, and after 30 minutes, I'm pretty much looking for a way to get out. I now do 45 minutes, 60 minutes, and often I'm quitting because I'm getting bored rather than getting tired. So that's yes, just
it's amazing. It's amazing. It's that's so exciting. I mean, I personally, my main fitness activity is Pilates, and it can be quite strenuous. And I've been kind of increasing the grade of what I do into more of the intermediate classes. And there's some moves that are really strenuous, and there's that amazing feeling when you're strong and you can do stuff, and I'm just like so happy that I could do things that I haven't been able to do, and it's like, yes, it's so great. Love it. Well, thank you for sharing that, because I think that we're just getting the stories in, and they're very interesting stories, and there's a lot of other benefits. So reach out to the person who introduced you if you're a guest this evening, and they'll share a little bit more if that's something that appeals to you. But the athletic performance is a big one. So are you ready for some questions?
If anybody feels skeptical, I'll tell you that I would never believe anybody who told me that story. So it's not logical, but it's what I experienced.
Well, You know what? You have to experience it to believe it. Yep. Especially skeptics. Okay. Anecdotal things from other people versus ourselves. Okay. Our first question this evening says, do the patches expire?
Do they? Not that I know of, although, I mean, it's a crystal, so it probably wouldn't. I'm sure in 20, 30, 50 years it will, but I don't think there's any identifiable shelf life.
The company does have to put an expiration date on it. And they do, and it is on the patch, on the sleeve, but I know people that have used it. It's a 2-year expiration, but I do know people that have used it 5 and 10 years later and work just fine. So like you're
Well,
saying,
here's a little secret. The pharmaceuticals all have expiration dates that have absolutely no meaning. There was only one pharmaceutical on the market that actually alters with age, and that's a tetracycline antibiotic. Everything else, it may diminish in potency over time, but for most of it, it's not even noticeable. And we would routinely send expired samples to third world countries who were able to use them and not throw them out.
great. Thank you for that. Michelle would like to know, she has a friend that has only 40% lung capacity and feels like he's breathing through a straw and he's really scared. Is there any patch placement suggestion you would recommend?
Well, there is a lung site at the, tilt this down, at the base of the sternum. That's an acupuncture point, and that would be a logical place to put patches.
And which patches would you recommend?
It would really depend on what the cause, that thing that we can't talk about, of the lung disorder. Is it an acute problem? Is it a chronic problem? Is it smoke-related damage? X39 would probably be good. The glutathione patch would probably be good. We would use in an office setting intravenous glutathione or nebulized glutathione to treat a lot of the chronic lung diseases. And there's good reason to think that the glutathione patch that stimulates your innate, your endogenous glutathione production might be helpful for that.
Wonderful. Wonderful. Thank you. The next question is from someone who says, I have someone who had success with an increase in energy the first 3 weeks with X39, but that seems to have stopped. Any suggestions or comments about that?
Well, you want to make sure that you are getting your fluids and doing all the other healthy stuff. The body, we're trying to get the body to swim upriver. We want to make sure that the river is not flowing faster than we need to. But you may want to add other of the patches, the energy enhancer patch, the carnitine patch. They have different modalities for how they help to improve energy. So trying a little experimenting and bolstering. We also want to make sure that you're getting the amino acid nutrients, the glutamine that is part of the tripeptide for the GHK.
Great. And you do have a nutritional background, and would you want to make any nutritional comments for this person in addition to that?
For energy?
Yeah.
Well, being a 74-year-old soccer player, I have a whole list of things that I do personally. I have a relative carnitine deficiency, and so I take a lot of carnitine, especially pre-game. I take a ribose product to help with ATP production. I use a homeopathic glandular that increases ATP production. There's a lot. Yeah,
okay, yeah. There's a lot, but the amino acid part and the minerals seems to be a big part of people getting, and the hydration. Okay, the next question is, so what happens to a person that uses stem cell activation after the age of 65? Well, here we have one. Do they still work?
Okay.
I think we got the answer to that one. Okay. If someone is going through radiation, is it advised to use X39 glutathione or any patches?
Is it advised? Yeah, well, it's not disadvised. It would not be a reason, in my opinion, not to do that. There are certain chemotherapies where glutathione, being a detoxifying substance, will detoxify the chemotherapy toxin, where the oncologist is trying to poison the tumor, and you don't want to take glutathione to counter that.
Excuse me, this person just said radiation. They didn't say.
They're not
Okay.
chemo. Yeah.
Okay.
Radiation also is doing the same thing. It's destroying the more rapidly growing cells, and there is a fear that I think is unfounded, that taking antioxidants and things like glutathione will inhibit that. There is some good evidence that it actually will enhance the chemotherapy and radiation therapy benefit.
Okay. Thank you. Jennifer is saying she has a customer who suffers from a heavy feeling when she exerts herself. She has extremely low blood pressure. And Jennifer says, I've heard stories from those who have normalized the opposite end of the spectrum. And I'm curious how to best support her in increasing her blood pressure besides X39 over time.
Licorice root.
All right.
Licorice has a substance that increases your blood pressure. In fact, one of the dangers of too much real licorice, not that candy, is that you can get fluid retention and high blood pressure. But it's one thing that I will often use in my patients that have low blood pressure and orthostatic. When they stand up, they get lightheaded and faint. It's one of the things that helps. You have to dose it gradually and build up to where you need to be, and you should have your blood pressure monitored while you're doing that.
Okay, thank you. Yeah, always consult with your practitioner when you're making a change.
So just to be clear, in licorice, there is something called glycyrrhizin. That's what raises your blood pressure. And there are products on the market called DGL, deglycyrrhizinated licorice, that we use for healing duodenal ulcers, stomach ulcers. But you don't want to get the DGL licorice. You want to get the glycyrrhizin.
Okay, thank you for that clarification. So what about someone that has extreme fatigue? Where would you start with the patches?
Yeah, again, it depends on what is the causing that. With extreme fatigue, I think maybe we're talking about people who are chronically fatigued, and there is a syndrome that has a name associated with being
very good, very good. Good job.
Yes, it's like I'm peeling a grapefruit from the inside. And there we use very complex ways of improving mitochondrial function. So X39 can be helpful in general. The energy enhancer, because it increases beta oxidation, moving fat into the mitochondria for burning, can be very helpful in that. Carnitine, sometimes Eon as an anti-inflammatory to decrease the load, the burden on the body systems, and help to balance the sympathetic, parasympathetic nervous systems, can help.
Beautiful. Beautiful. So let's see. Patty's asking, I have nerve and joint pain and extreme weakness in my legs, and I'm unable to bear weight. Should I use X39 and X49?
I try it. I think that there is no cut and dry formula with these kind of products. There's no roadmap. There's a map of roads, and we've got to try all those different roads and see what works. So yeah, try them and just see. But I would also look at the the ice wave for general pain management.
Great, great. And let's see, this person is having a surgery in a few weeks and wondering what you would recommend for diminishing scar tissue and cleansing of the organs post-op.
Yeah, I actually have a surgical a supplement regimen that if it's all right with you, they could contact you. I'll send you that support
Okay, great.
program.
So I don't know who that is because it says anonymous. So you can reach out to me. I'm readily available. rbmascari@mac.com, and I'll put that in the chat. And okay, so we got time for just one or two more. Glenn wants to know, what patches do you recommend for a child who's a male that has retention challenges, and to have him stay still for a little bit?
Retention, I presume that means learning difficulties.
Yeah.
Retention of,
Yep.
retention, so I'm going to assume that's learning. I think that we're going to be seeing good results with X39. I don't think we can report that yet. It's one of the studies that I would like to be starting soon. Carnitine also has a benefit on cognitive function, on brain function. If the glutathione may be beneficial in some of the childhood syndromes that go unnamed.
Very good. We're getting good here. And everyone, I just want to acknowledge everyone. You've been doing a great job of not naming anything this evening, so I haven't had to skip over anyone. And Anne is saying that someone actually lowered their blood pressure with just X39. Isn't that wonderful? So I'm actually noticing we are past the bottom of the hour, and let's see, there's one more. What patches would be protective for being around the people who have had the injection that's going around these days?
What patch would be protective?
Yeah.
There is contrary to some misinformation, there is nothing that needs to be protected. There's nothing that leaves the body from the injections.
Okay. And Chris wants to know if you do consultations.
Yes, there's a hesitation there. Limited, yes. I've generally been functioning consultations on the most severe and chronic disorders that are difficult for your regular docs to take care of. But I will, for Robin, I will do. For you, Rob.
Thanks, Dr. Stewart. Well, everyone, thank you so much for putting your questions in the Q&A, and that just made it really easy for me. And I want to thank you, Dr. Stewart. Great to have you. We always get to learn so much from you, and you're a gift to all of us. And, you're a model of health and vitality. And someone said to me once, don't ever go to a doctor that's not healthier than you. So I bet your patients love that about you. And running around the soccer field with 20-year-olds will definitely do that. It's inspiring, and that's what we all get to be, is inspiring, as we get to really live a full, healthy life and not be limited with those signs and symptoms of the aging process. Things can actually get better and better. So thank you, everyone, for joining us this evening. If you're a guest on the call, thanks for being with us, and I hope you learned a lot. Please get back to to the person that invited you and get started. There is no risk. The products do come with a 30-day risk-free guarantee. As we say, there's nothing to lose but your health to gain, and give it a try. We have a wonderful customer program, and we also, if you're the kind of person that likes to share, a generous plan to compensate you for sharing with other people. We are in the sharing and caring business, and we need more voices to help more people out there in the world have the quality of life that can be better and better. So thank you everyone for being with us. Good night. And thank you, Dr. Stewart.